It just limits the depth of the
Namaskara. I am Lingaraj Ars, the Aam Aadmi Party candidate from KR in Bangalore. I decided to fight the MLA elections this time purely and simply from the courage and the experience I got from my 2015 experience of being elected to the Kanamangala Gram Panchayat. I've always been very passionate and aspirational as far as politics is concerned, but have been governed by the middle class values and certain thoughts and teachings of my late grandfather, Sri Devaraj, the former Chief Minister of Karnataka. He often would say that to be successful in life, one had to be grounded, one had to be self-made, and must learn the value of hard work. With these thoughts and lessons, I had a very humble beginning to my career as a salesman. And then in 1995, Genesis from UK approached me and wanted me to take on the role of managing the India operations. They then mandated me and my team to build the US operations, and now Genesis as a company is flourishing, it's profitable, it's doing very well. We've had the opportunity to provide employment to over 10,000 families during my tenure of 24 years in Genesis. My aspirations for KR is very simply to get rid of the apathy and the corruption that prevails in this constituency. It is the second largest constituency, and for 10 years running, it has been struggling under this kind of poor governance, which it certainly doesn't deserve. My model for KR will be on 4 pillars: education, healthcare, environment, and civil infrastructure. Thank you for joining me today on this live session. 7th of April is celebrated the world over as the Health Day, as the World Health Day. It is also the anniversary of the World Health Organization. Every year, WHO adopts a theme, and this year, in 2018, the theme for the World Health Day is Health for All. I want to introduce you to the healthcare and the system that currently prevails in KR. There are over 7 lakh people in KR. But unfortunately, it does not have a multi-speciality, or a super specialty hospital that can address the needs of the population. The government hospital in Keyapuram is very poor in its infrastructure. So much so, when I visited them, they did not have sheets on the bed. Male patients had to use the ladies' toilet. The staff was overworked. How could we have this going on in the 21st century? There's something else which I noticed as well. The food was stored in steel cupboards, which was infested with cockroaches. The overall hygiene level was very, very poor because they don't have the manpower to maintain the area. The vaccinations for children were out of stock. Right to health is inscribed in the Indian Constitution. And the international diktat in the form of Universal Declaration of Human Rights is something which bestows on each and every citizen universal health care. I propose to bring, if elected, the AAP or the Aam Aadmi Party healthcare model, which has been implemented in Delhi, being adopted by Haryana, and was spoken of at length in Karnataka as well. But like many of Siddaramaia's programs and many of his initiatives, this also did not see the day of light. Aam Aadmi Party has created a 3-tier structure, a structure which at the basic level provides for what it calls as a Mohalla clinic, which caters to 2,000 people and conducts over 80 odd tests free of cost. Cases which cannot be handled at the Mohalla clinic are then referred to the polyclinic, where slightly more complicated patients are dealt with, and patients who need more intensive care are then handed over to the super specialty hospitals, which the Aam Aadmi Party has developed in the last 4 years. It has added, the government in Delhi has added almost 3,500 beds and is confident of adding and taking it up to 6,000 beds in total, and 6,000 new beds during its tenure. And in the last 15 or last 25 years of both BJP and Congress rule in Delhi, only 3,000 beds were added. Now, this is a stupendous achievement by the Aam Aadmi Party government in Delhi. Such a successful model where the taxes which we pay are being positioned, are being used for the benefit of the people, is something which I would like to bring and offer to the people of KR as well. There are some statistics I'd like to share. There are 6 super specialty hospitals in Delhi with over 11,000 beds. And there's something unique about it as well, that in the event that the super specialty hospitals cannot cater to the volume, the economically weaker sections especially can avail the same facilities from 69 private hospitals in Delhi. This model of primary health care has achieved quite a bit, and some more statistics to talk about. There are 242 allopathic dispensaries, 107 mohalla clinics, 23 polyclinics, 39 Ayurvedic clinics, 19 Unani clinics, 101 homeopathic dispensaries, and 70 school health clinics. Now, isn't that wonderful? If we had something similar in KR. The Aam Aadmi Party has launched the home to hospital care scheme as well in Delhi. The ambulances are equipped so well that the golden hour care required for any patient can be administered skillfully and with great ease before the patient reaches the hospital. This is almost like a dream come true. And this is exactly what people in KR deserve as well. This is my vision of healthcare for KR. Thank you. Jai Hind, Jai Karnataka.